If I'm working with a client who's been diagnosed with SI joint dysfunction, I want to make sure that I'm working with the soft tissue that surrounds that joint. The first thing I usually want to do is slide my hand underneath their back so I can palpate their SI joint and bring their hip through its range of motion and try to detect where their pain is, what I feel, and if there's anything else going on that I think might be contributing to their low back or hip pain. As I slide my hand under my client's hip, I'm going to hook my fingers up so that I can start to feel the movement of the SI joint as my client pulls their knee up towards their chest and moves that SI joint through its range of motion. As my client pulls her knee up towards her chest, I'm sliding my fingers down. So not only am I palpating what's going on, I'm also starting to lengthen that connective tissue that's stuck behind the SI joint. It goes without saying that it's incredibly important to do this on both sides to ensure that you understand what feels normal for your client. Once I've gotten a good sense of what's going on in my client's low back, I'm going to start the work. And I usually like to start by connecting their low back to their sacrum. So as I slide my hands down their erector spinae group, I'm really going to use my thumbs to hook into the sacrum and apply some nice deep myofascial release across the sacrum and out across the ilium, so all those thick layers of connective tissue that cover the sacrum and the ilium and go deep into the SI joint start to soften. By hooking into one hip and the opposite shoulder, I'm also addressing any upper cross syndrome that might be going on and allowing the connective tissue its own space to start to move in a direction that it's supposed to do. As I come back down into the SI joint, I'm starting to think about that joint and how it's really held tight by a lot of connective tissue, but sometimes that tension is exactly the problem. So as I use my thumbs to apply some deep pressure into this joint, I'm thinking about giving that joint the little bit of movement that it's supposed to have. A lot of the work that I do with the SI joint starts with the sacrum. And direct work on the posterior sacrum is going to start to release not only that superficial connective tissue that I was talking about, but also all of those deep spinal muscles that come down and actually lay flat on top of the sacrum and really don't very often find relief. Very slowly and methodically, I'm going to sink my fingers down onto the sacrum and I'm going to start to push away laterally. So I'm kind of scraping off the sacrum and then falling off the ridge of that joint into the ilium and into the glutes and starting to peel away all of that tissue that's locked in centrally. My intention here is to sink down first into the sacrum, and then as I slide out, I'm letting my fingers slide over the bumps of the sacrum, over the ridge of the SI joint, and allowing those ligaments to start to detach. Placing a pillow under the client's low back and hips can often bring some space into an area that is otherwise pretty commonly compressed. The pillow in and of itself can feel good. With this technique, I'm concentrating on pulling the connective tissue that is interwoven into the spine and the spinal muscles down towards the hip and crowding that tissue down into the SI joint while using my other hand to pull up and away, twisting that connective tissue open and free all along the low back. Because the SI joint is so deep in our core, it shows up as many different symptoms, but one of them can be back pain in general. And so what I like to do is hook into the SI joint and down along the sacrum and along the ilium and pull down a little bit, offering space in between each of the vertebrae and offering a little space along the iliac crest. As I mentioned before, dealing with SI joint dysfunction with a client as a massage therapist is about helping the client manage pain. I'm not going to go in and fix the joint. I'm going to go in there and help the muscles that have started to guard around this irregular function and irregular movement of that joint that is so intrinsic to our core. So with this work, I'm focusing on the layers of the thoracolumbar fascia. As I start down at the sacrum and move up along the spine, I'm sinking through each of those layers, and I believe there are 4 that all play a role of attachment sites for muscles and holding the low back into place. I'm going to start to peel away at each of those layers and release anything that feels adhered and stuck. For this last move, I'm going to bring my client up into child's pose, which I love. I love this pose for myself, and I feel like it's so advantageous for the body in general. Once I've got my client in this position, I can really press down on the sacrum. And if you've ever taken a yoga class, you know how opening this can feel. But if you think about the structure of the SI joint, this is the perfect position to really do some last-minute setting into place. If being on the table with a client feels too difficult, obviously we can get down and use our forearms in the same manner. And so with this technique, I'm just kind of doing a broad twist. And I'm just ensuring that all that work I've done is settling in. What? What even happened? I didn't do anything. You're not allowed. You know that. On the table, there's no thinking.
I'm sorry,